increases in number, the knee joints are affected the most. The only thing that can really help you is if you have an optimum weight. So that's one thing. The other thing is if you strengthen the muscles that are stabilizing the knee joint. The knee joint is so painful because there is inside capsule is inflamed, because there is some tear, there is injury to the meniscus, which is the shock absorbing soft bone. In that case, sometimes we put a little anti-inflammatory medication in the joint. Welcome to Dr. Nasar Shahid's forum for how to prevent diseases, prevent chronic pain, and how to achieve well-being. Today, I'm going to talk about how you can take care of your knee joints. As we become more mature and our age increases in number, the knee joints are affected the most. Why is that? Because knee joint has a specific function of weight bearing. All your weight is on the knee joint. And the knee joint is not like there is a cup and another bone comes and fits into it like hip joint. Actually, it's bone on bone. And that's it. So the whole body weight is on that knee joint. So if you are 200 pounds, 200 pounds are on knee joint. If you have 500 pounds, 500 pounds are on the knee joint. So that's only when you are standing. But when you're walking, 3 times of your body weight is on the knee joint. When you are going upstairs, negotiating the stairs, going up and down on the stairs, it is 6 times your body weight on the knee joint. And when you're squatting, like you're picking something up and you're squatting, it is 9 times of your body weight on the knee joint. That's why if some injury occurs to the knee joint, it does not heal because continuously you're walking, going up and down stairs and squatting. The only thing that can really help you is if you have an optimum weight. So that's one thing. The other thing is if you strengthen the muscles that are stabilizing the knee joint, because this is bone and bone, so it has to be stabilized by the muscles around it, especially the front muscles, that cross only the knee joint. So out of the quads on the front, the muscle that only crosses the knee joint, mainly it is the vastus medialis oblique. So vastus medialis oblique muscle is the one which mainly stabilizes the knee joint. So you have to strengthen that muscle. How you strengthen that muscle? Simple, by straight leg raise. Because when you do straight leg raise, you don't move the joint. You don't increase the intra-articular inside the joint any pressure. So as a result, the joint is not affected by your movement of the straight leg raise, but the muscle is strengthened, especially if you put some weight at the ankle level. So initially you do it without any weight, but after a few days, after 1 week, start putting 1 pound, then start putting 2 pounds, 3 pounds. Actually, there are ankle brace available in which there are weights in the pockets. So increase up to 5 pounds and do 10 or 20 times sets, and your front muscles will be strong. And that is another step you can do to decrease the pressure and injury to the knee joint when you're walking and you are going up and down stairs and you're squatting. Well, this is a very good way, but sometimes the knee joint is so painful because there is inside capsule is inflamed, because there is some tear, there is injury to the meniscus, which is the shock absorbing soft bone. In that case, sometimes we put a little anti-inflammatory medication in the joint and numbing medication, clear the inflammation, and do these exercises. However, sometimes all these things fail. So you must do these things anyway, whether you are going at the end for surgery. Sometimes this wear and tear in the body does not heal on itself, and you have to go for orthoscopic surgery. That means you put a camera inside and shave some area or put a stitch somewhere. The orthopedic surgeon decides what he has to do. And sometimes the osteoarthritis, the degenerative process, is so involved in every structure of the joint that the only thing that helps you is knee replacement, and we will talk about knee replacement sometime. But basically, if you have to go in that direction, you must take all the steps which are short of surgery. So decreasing your weight, strengthening the muscles, and then maybe having some injection. Other than that, two more things you have to do. You have to make sure you don't eat the food that is too much of animal origin, because the animal origin food accelerates the degenerative process. So the plant-based food should be the main staple food of your body. So that's one thing you can do in addition to doing physical activity. The other thing is you must sleep in the early part of the night. As I always say, early part of the night sleep is actually essential to improve your immunity, to improve to repair the wear and tear of the day and night. And so if you follow these steps, which don't cost any money, and they are going to help you have a good knee joint. Remember, your knee joint at this time, if you are 10 years old or 20 or 30 and 40, if you take care of this joint now, it will help you when you are 80 and 90 and 100. Because at that time, mobility is the key to have a successful existence. At that age, the most important thing is recognizing your dear and near and mobility. Two things. And in both things, the things I have mentioned, the steps I have mentioned are going to be helpful. So if you want to have a graceful aging process, work now on your lifestyle.